So I'm going to bring it back. Do you feel like it's pretty tight against the ankles and feet?
Yes.
All right. Alrighty. Going back. All right, hi guys, Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. And here, you're seeing me use some of the inversion. We've had someone with low back type injury and getting a course of treatment, but not helping very much. And so you went through quite a bit through the medical route and PT and some other things. Didn't help, still in pain. And all of a sudden we started making, this is what, our third or fourth session now?
Yes.
Yeah, so our third or fourth session. And a couple things, I've been doing a few things with him. The inversion table, adjustments, arthrostim, and co-laser therapy. And the swelling on the disc is starting to go down, and the numbness and tingling is starting to go down the legs. It's reducing actually, okay? So we're doing some of the inversion with him, and this is our third session on here. Yeah. And we'll bring them down right here, drop the weight into the heels a bit, or into the feet, a little bit into the knees. So a lot of things, you can buy these at home and start to do it yourself on the inversion table, but a word of warning and caution. This is at your own risk. If you don't know some of the history behind what's going on, you could actually make things worse when doing the inversion table. So really simple and easy. Less is more. That means hanging for a short period of time, and that could mean even just laying at a flat incline or what's parallel to the floor to start out with. Do this. If you get one of these pieces of equipment, have someone around to assist you like I am here. So this is a type of traction. It is a general traction. It's not as specific as you'll see in some of the chiropractic offices with the decompression, or the physical therapy offices, the Chattanooga tables, where it does a distraction and takes a lot of things into consideration, like your weight, height. Okay, we're going to bring them back again. I try to give them a good 30 seconds to a minute rest. We're going full inversion now with him right now, and this is actually, you good?
Yeah.
Doing a nice inversion against gravity pull for that lower back where that numbness, tingling has been. And first we did in the other room, we had taken him to the distraction table where it did a flexion type movement, or flexion distraction. We put some heat to loosen him up a bit. We used the instrument to get into there, and then we came over here and we are now doing the inversion table to get some pressure off that nerve. I'm trying to do under 20 seconds for him, or around that point. And we're doing a series of these as well. The thing that's missing there, and that you'll see at the end, is a specific chiropractic manipulation to the lower spine. And we had to get some of that inflammation out of there and get those joints moving a lot easier for him. So when things are locked up, or there's an injury, old chronic injury, more difficult to work with because it gets set in a wrong position, and it starts the inflammation lays down in 3 days, and then the scar tissue and the adhesions and the type 3 type collagen start to set in there, and that is 70% weaker than the original type 1 type collagen in there. So, or not as strong, I should say. Okay, we're going to do a third time here. Let's bring it back. And so this is our third session with the inversion, actually, with him. And we had to build up to this. I started out, I had to see what his tolerance was for inverting and this type of traction that's being done. And then if you can go ahead, just gently twist your body, just slow, just create some movement in there. And I did this last time, just to see if he's relaxed enough while he's hanging there, because some people will hold on for dear life. You got to make sure those legs are locked in there. I'd hate to have you injure your head as well. Okay, you good there?
Yep.
All right, we're going to bring him up. Slow. Good. out of this, you want to bend your knees, drop the weight into there, drop the weight into the heels. Use this for leverage coming out of the actual apparatus and come out slow. He actually moved at a pretty good pace. All right, let's have you lay on your left side for me. We're going to be moving that L4, L5 area. It is opposite way. A little bit lower for him down in the pelvis. You're going to feel like you're falling off here. Good. On your back. Breath in and out. Breath in. Release it out. Pretty good cracks there, huh?
Oh yeah, felt really good.
And then go face down. And we're going to get the cold laser on that lower back area for him. And let's test some of that strength back in the legs again. Can you raise the right leg without bending the knee? And back down, the other one. Back down, good. And actually, I'm going to have you remove that belt again. We forgot about that. All right, have it on the pre-settings. And you may even see some of the laser light going on here. There's an ultraviolet light and an infrared light. It's targeted specifically where the disc herniations are in the lower back. Actually, I'm going to target a little bit like this. Right there. So we have 4, 5, 5S1. And so he's getting that pain in the legs and then that numbness tingling down as well. Comes right from this area here. So I leave this on for a period of time. With them to help reduce some of that inflammation coming out of the nerve root. It was down the right leg, correct?
Yes.
Yeah, this one. And then I as well do, because he also had a double impingement coming right through this area on the piriformis as well, so I'll do that as for him as well. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. And if you have a herniated disc, bulging disc issues, areas in the spine or lower back that are bothering you, give us a call. I'll see you soon. Thank you for watching.